Welcome to Work from the Inside Out, a podcast that highlights real-life stories, practical strategies, and best practices for transitioning your career from unhappiness and dissatisfaction to fulfillment, meaning, and joy. Now here is your host, career and executive coach, Tammy Guler-Loeb.
Hey everybody, welcome. I am so delighted to introduce you to my guest today, Wendy Marks. To complement her knowledge of non-traditional health therapies, Wendy has a broad range of expertise with traditional medicine. She holds a post-master's degree in Rehabilitation Counseling and a C.S.S. degree from Harvard. She is a fellow of the American Psychotherapy Association, a member of the Association for Comprehensive Energy Psychology, and a diplomat of the American Association of Integrative Medicine. Please note that Wendy Marks does not diagnose medical conditions or prescribe medicine. She is a partner in health with her clients to help them achieve a happy and healthy life. With significant experience in helping people improve their physical, mental, and spiritual health, she provides medical intuitive sessions, energy healing, integrative therapy, and shamanic studies and healing. Wendy says, as a healer, I strive to work with individuals in a way that promotes a peaceful and healthy planet. So please join me in welcoming Wendy Marks. Thank you, Wendy, for joining me from your home office in Needham, Massachusetts.
You're welcome. I'm happy to be here.
I am delighted. Wendy, I will tell the audience, Wendy and I have known each other for many years. I have actually been a client of Wendy's. So I have direct experience, pleasurable and helpful experience working with you, Wendy. But I also know that your career started in some other dimensions, and that's why we're here to talk about career transitions, professional transitions, life transitions. So let's start with hearing a little bit about your background and the kinds of things that you did earlier in your career and what led you to the practice that you have now.
I actually grew up in Brooklyn as a garmento, which is a child of the garment business.
Wow, I didn't know that.
Spent my early childhood sewing on buttons, both in the factory and at home, and running sewing machines back and forth and back and forth and back and forth for hours and hours and hours, and was the first generation in my family to go to college. So,
wow.
So there were aspirations in my family to go to college. Our generation was really the first. So I went into the deal not knowing much about what I wanted to do, but I knew that I had problems, so I went into psychology. And which is a reason that a lot of people go into psychology.
Yes, and coaching,
and coaching, and all of the helping professions. And so I studied psychology and could not decide between psychology and medicine. I loved them both so much. So I became a rehab counselor, which is a combination of both psychology and medicine. And so past our master's level, we study for a year with, now in my case, a DO, or it can be an MD, a doctor of osteopathy or an MD, and a year with a psychologist. So we are a hybrid vehicle, at least in theory.
Okay.
Yeah.
And what kinds of people were you working with in that early part of your career?
The very earliest part of my career, especially during my internship, I worked at a mental hospital. That was not so much fun for a psychic person. And at a VA hospital in Springfield, and at the prisons, a couple of prisons. They wanted us to have a wide range of experience in the beginning.
Wow. And a depth of experience, it sounds like. So when you say it wasn't pleasant as a psychic person, can you explain to us a little bit more what that means?
Yes, because it's really relevant to the transition. If you're a psychic person, any psychic person, you're empathic, which means that you're able to feel what others are feeling. And if you have not learned how to shield yourself or create good boundaries in your world to do this. If you enter a place like a mental hospital or a prison, you are bombarded with feelings and emotions and thoughts and sensations that you as a little baby person have no ability to deal with, or at least in my case, had very little ability to deal.
So you were aware of your, I guess I'm calling it sensitivities, because as a young child, you may not know what's going on, or you may not be aware that, doesn't everybody feel this way?
Mm-hmm. I really felt that everybody felt this way, and I was confused to learn that everybody didn't feel this way.
Yeah.
So I was very determined, because the psychic gifts had, to say the least, as a child, not been easy for me to manage.
Yeah.
Both from an emotional point of view and also from a world point of view. People would, the view of people as looking at you like you were crazy or weird or scary. Scary was the word.
Because of the things that you would say to them or share with them? Yeah. And as a child, you don't have that many filters. So you probably just saying what's true for you, right?
Right. Like, oh, Aunt Jean has a lump in her breast. I wonder what that means. That was probably.
Wow.
Mm-hmm.
Ooh.
Mm-hmm.
So tell us a little bit about your evolutionary path. You've talked about the education that you went through, but I'm wondering about, how did you discover that you weren't the same as everyone else, and start to really, I don't know, give it a name or give it some shape or focus, that you had something that other people don't have, or you see things other people don't see. And was that early enough in your life that you then made certain choices about your education, or was it as a result of some of that you started to realize there were different pathways you wanted to necessarily take this to?
I wasn't mature enough for the second option.
Okay.
In my family, half the people are psychic, so it wasn't
Oh.
considered normal. But medical intuitives were not something that anybody knew what they were, and I wouldn't even know that term or what it meant.
Yeah.
I just didn't understand that other people couldn't see into other people's bodies. So because of the reaction of my peers, my teachers, and others, I was determined, and this is where the career shift thing happens, to get away from that and to get into that closet and do things that were traditional and do things that were fact-based and on the paper and through the lab tests and documentable and certifiable and researched. So I chose that.
I see. So you were hoping to kind of put that part of you in the closet, as you say, right? Mm-hmm. And really develop a set of knowledge and skills and abilities that were more, kind of on the straight and narrow, so to speak.
Yes, I was going to go empirical. And I tried that, but I was unable to do it because my gift didn't shut up.
Right. So you kept coming out of the closet, as I know you've used that phrase before.
Yeah, well, I didn't come out of the closet. I kept saying things to people like, wow, I think it might be a good idea for you to go back to your doctor and maybe get an MRI. I just have a feeling that there might be something. And it took me a long time to realize that was invasive, intrusive, and I was doing it without their permission. Which was not cool.
So, but at the time, it sounds like your intentions were only good, that you were trying to help somebody find some of the answers that you might have already had, but get them to that point where they could actually get help with it.
Right. But I was also trying to remain in the closet and not have anybody understand that I was seeing things that others weren't seeing. And it was getting harder and harder to justify the things that I was coming up with.
Yeah. So it's kind of this makes me think of some of the other conversations I've had with people who've made these kinds of transitions, or made transitions where they go from being the professional they think they're supposed to be, to really further aligning both their values, their instincts to what they're doing, so that they feel better aligned as a human being in general, and to be able to really live in a place of truth, but also in a place of service too. So I'm wondering how you started to allow yourself to kind of reconcile that or build those bridges? What can you tell us about that process?
Yeah, it was actually pretty dramatic.
Oh.
Yes, we have a little drama here. I had started a business with another woman doing geriatric care, and we had built this into a very large business, the largest geriatric care management business in New England at that time.
Oh,
We had
what kind of
400
care were you doing?
We were working with elders and doing home care and care management,
Oh, so
planning
really,
of care, and all of that stuff.
so
And we had a
really
staff
hands-on care, not just like case management, things like that.
both. We had a staff of 450, and it was a big company.
Wow.
And we were doing good and doing well, which has always been my goal.
Mm.
And the moment of crash came when I saw that my business partner had breast cancer. And I didn't know what to do.
In terms of telling her what you saw, or?
Right. In
Wow.
terms of, right.
Was
And
she aware of your gift?
yes.
Okay.
Yeah. So she also knew me very well. We had worked together for 12 years. So I said, hey, let's go get mammograms. She said, what did you see?
Mm.
And that destabilized the relationship in some fundamental way, ultimately causing the breakdown that ended up having the business have a hostile takeover and everything else, because
Wow.
our relationship was destabilized by me not being myself. And it was this huge realization that by not being who I was and out of the closet,
Yeah.
she felt that I had breached her privacy. It saved her life, but that didn't matter. She felt that I had breached her privacy and gone across a line by looking into her body. I wasn't trying. It just
No, I mean, that's what I'm hearing. You weren't trying, and
No.
not that we're trying to defend you here, but how can you see something and then not say, see something, say something? Gee, that sounds kind of current. How could you not? I mean, and clearly you couldn't. You had to say something.
Well, I couldn't, but maybe others could. And also, she saw it as a boundary violation. And I came to realize through that others would see it as a boundary violation as well.
Mm-hmm.
That I didn't have a right to look into their body.
Well, if you had an on-off switch, that would be handy, right?
Well, you come to the point where the transition occurred.
Okay.
I went to a shamanic teacher and said, I need an on-off switch. I didn't say it quite like that. I said, I need to be able to not look.
Yeah.
Teach me how to not look. I got to be able to turn this off so that I can turn it on and turn it off, and so that I can function in the real world and be able to do this. And over 4 years of study with him, while I was still doing more traditional work, I came to understand that I was supposed to be doing this work.
Right.
That I was given this gift for some sort of reason, and that very few people had it. And so therefore there was an obligation, if you will, to take this and use this in an appropriate manner, in a situation where I was getting permission, in an environment where it was open what I was doing, and an environment where people were coming to me who actually wanted me to look at them and see what I could see. So it was rather dramatic, rather traumatic financially, rather traumatic emotionally. I lost that friendship as well.
I'm sorry about that.
But it was meant to be. I was meant to then make this move to work with the shamanic teacher. If you told me 5 years before that I would work with the shamanic teacher to try to learn how to control the psychic gifts, I would have said, you're crazy. I'm fine. I've got a profession. I'm doing okay. I'm working hard.
Yeah, I've got all the trappings of success, right? And that's the whole point of this podcast, is work from the inside out. You had all the outside pieces handled, and the inside piece was pulling at you, tugging at you, and screaming at you, saying, this has to be, you have to come out and stay out, right?
I also felt enormously guilty because I would be in situations with people where I was in a counseling role with them, and I would know, for example, that they had something really terrible wrong with them. And I was struggling with myself how to try to either say that or not say that, and what was the right thing to do and what was the wrong thing to do, and in what context, and so on. It was a battle all the time.
Yeah, I can imagine that must have been, and I say it in past tense when in fact that may still be a battle for you. I don't know that, but I can only imagine, there's so many things in our lives that we try to control. And this is something that just happens, right? And you could recognize that it was happening. And the real pivot point was, what do you do with it? And it sounds like you were searching for the best way to both be true to yourself and also exist in the world in a way that also aligns with your values for respecting other people's boundaries and not making decisions for other people that they need to make for themselves, right?
Right. And my shamanic teacher at that time I used to say to him, "You can't make me do this." And he used to say, "No, I can't." And I used to get very angry at him.
Yeah.
I should be able to turn this off and leave it off. And
Yeah.
he'd say, "Well, do you think that you got this gift for no reason?" And I was very angry initially because I had worked so hard to become normal.
Right.
Or look normal.
Right. Right. But it sounds like it had to be tearing you up inside in some ways. And I think that, your situation is probably somewhat distinct from some of the other people I've been talking to about their transitions, where maybe they had some kind of inner battle that they were not honoring certain values, or they were not really listening to themselves in terms of what really felt right to them. And yet it sounds like there's something within you that is even to some degree beyond your own control. You can't just create a reframe for how you're thinking about this when these thoughts are coming to you and there's a, let's say, excellent, if not amazing degree of, that this is really happening in this other person. I don't know if you've ever had an occasion where you've thought you saw something in somebody and it turned out to be something else. I mean, I would imagine,
Oh, sure.
that you're human also.
Of course. That's my big fight with God.
What's that?
That's my big fight with God.
Oh.
I always say, if you're going to give me the gift, make it 100%.
Make it 100%. Yeah.
Yeah. Otherwise, don't give it to me, because it's no good to me if it's not 100%. Because I don't want to be in a situation where I'm giving somebody information and it's not correct.
Right.
And I did do statistics on it, and I'm about 97% correct for diagnosis, but that means I'm wrong 3% of the time. And that's one of the hardest parts of what I do.
Yeah. Wow.
You don't want to miss cancer. You don't want to miss a lesion that, you don't want to miss something big.
Well, and I know from my own experience with you, and having brought family members to you, that you're pretty careful about saying what you see, and in your experience, what you have seen in the past in similar cases, and that, go get it checked out. Don't just take my word for it. Go get it checked out somewhere. There are ways to confirm these things. So, I think you're meticulous in terms of your care in that way. And it must be leaving you in a far more peaceful place than it had been, that you're able to speak to this now. And also you're in the business of this now. So people are giving you permission to look at them and look at their bodies and look at their beings and helping them to identify what might be going on. So with that permission, it gives you a whole world of peace you probably didn't have before.
You have hit the nail on the head. It gives me a world of peace because somebody is coming to me and saying, "Tell me what you see."
Mm-hmm.
Tell me what you see. And often I'm the last caboose on the train.
Yeah.
People have been to every other place to find out what's going on.
Right.
And I have favorite experiences of this, if you want to know, but that's usually the case. I'm usually at the end of the road.
Yeah.
So I am often able to get people steered in the right direction to figure out what's going on. And by the time somebody gets to me, I would say 95% of the time, they're ready to hear whatever it is because they just want to know.
Yeah. Yeah. They're tired of not knowing. And I'd love to hear an example or two. I also want to make sure that we fold into this sort of a little bit more about the process of how, well, we already heard the part of the story where things kind of imploded, and you had a lot of stressors and strains on you. How did you then take that knowing that this is not working? I've now, upset a friend and colleague deeply, and yet I need to bring these gifts to light, and I need to find a way to make a living doing this. So how did you make that transition, or how did you determine the ways to take those steps?
To make the story even more dramatic, I was simultaneously going through a divorce.
Oh, wow.
I always say I lost 2 marriages at the same time.
Wow. Okay. That's big.
And I had a small child. So I just didn't have time to really think about, oh my God, what's going to happen? I just sort of started setting out a shingle and opening my doors and contacting all my people that I knew in my life and saying, send people to me.
Okay.
And I was working as a consultant to try to keep my kid fed. And then, and that wasn't so much fun. And
as a consultant, what, in like a rehab setting or something like that?
I also have a master's in business, so I was doing nonprofit administration consulting.
Oh, okay. All right.
Because I have run several nonprofits and I know all the things that people do wrong because I've done them all wrong.
Yeah. Nothing like the
what a surprise.
The benefit of experience, right?
So I was doing that, but I was trying to build up a private practice, and I had no idea whether it was going to work or not. I just kept pedaling the bicycle and said, I have to have faith that if I was given this gift, it was meant to be used. And eventually it picked up enough so that I was able to match what I was making when I had the business.
Okay. So it sounds like you took an incremental approach, which is something I often recommend to people myself when they are thinking about moving from either full-time or part-time employment into, doing something more entrepreneurial or, self-employment. And it sounds like that's what you did. You found a way to, this is the sort of the pragmatic side of the story, which is, hey, I had a kid. I was going through a divorce. I had taken quite a hit financially with the business, and I needed to keep bringing in some cash. So you capitalized on skill sets you had to, make sure that you had some money coming in while you built up your private practice.
Parenthetically, I hated it. But that was okay because I had something that I could pull out of my hat and do while I built the other piece of the practice.
Well, you may have hated it, and it was very purposeful. You were being on purpose from what I'm hearing. And
and I could balance it with childcare.
Yeah.
And that worked too.
Yeah. And you were going through probably some of the most stressful experiences anyone would go through in their lifetime. So it sounds like you also have kind of that, we say, oh, you're a psychic, you're, woo, 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 and yet it sounds like you have a very sort of pragmatic, practical side to you.
It's hard. That's why a lot of people that are psychics have a hard time functioning outside of a structured environment because they don't have that. I always joke, and I'm not a big astrology buff, but I always joke about being a Virgo psychic. I'm like, oh, I'm a Virgo psychic.
What does that mean, a Virgo psychic?
Virgos are control freaks who like to have everything organized.
Oh, okay.
Neat and in position and not out of place. So I make jokes about that. I had those two sides of me that allowed me to do this. But I sort of had a kid. I mean, what was my B choice? I had a kid. I had no money. I really didn't feel like I had a B choice. I had to just do something. I did not. I didn't know if it was going to work or not to to do what I did.
Right.
But I was going to give it a shot. And
Yeah.
the worst case scenario was I go work for a facility or a company and go back to rehab counseling if I had to.
Right. So you had a plan B if need be,
Yes.
so to speak, right?
Mm-hmm.
So tell us, so it sounds like you have a few, it'd be great. There are probably people listening to this who are saying, well, okay, so she has this ability. What does it look like? What is it, what are some good examples of how you have, helped people that, that not only that you've helped them, but that it leaves you feeling like I'm really where I need to be in the world and I'm doing what I need to be doing. Any good illustrations of that?
Yeah, I have my favorite story, and I have to make it unidentifiable. I had a woman come to me who was much like many of the women I grew up with. She was an older Italian lady with that pink teased up hair, that sort of great pink teased up hair, and the giant horn, around her neck, the giant gold horn.
Oh, yeah. Okay.
And I just loved her from the minute I set eyes on her. And she was sort of built like a fire plug, and she was very strong, and she had her own trucking business.
Oh, wow.
I loved her immediately. And she came to me because she was in the hospital. She left AMA, Against Medical Advice,
mm-hmm.
because she had spiked high blood pressure unbelievably fast over a week period. Her normal blood pressure had gone to death, like by stroke type blood pressure. And she felt that there wasn't anything wrong with her. They kept her in the hospital for 2 weeks, and they kept testing her, and nothing worked. None of the drugs worked. And she said, I'm walking out and finding an alternative. And one of her friends had seen me, and she said, I don't believe in you. I don't think this is real. I don't know if anything, but I don't know what else to do when I want to go to my son's wedding in 2 weeks in New Hampshire. So I said to her, okay, let's try. So I said, well, there's a condition though. And she said, what's the condition? I said, if I figure out what's wrong with you, you have to let me drive an 18-wheeler.
I love it.
She said, only in the yard because of my insurance.
Okay, fair enough.
I said, deal. So I took one look at her and started taking a history, and realized that she had been in a car accident 4 weeks ago. And my alarm bell started immediately ringing. I said, okay, this woman has had normal blood pressure all her life. She was in a car accident a few weeks ago, and now her blood pressure is going wackadoodle. Do we think there might be a connection? Nobody had even asked her that. So there's a piece of my work that's still the rehab counselor, medical training, get a good history piece, which I have to put together with the psychic piece. I took one look at her head and neck, and I said, oh my God, this is being caused because the autonomic nervous system is being compromised because of some spinal issues that happened during the car accident that you had. It has nothing to do with your cardiovascular system.
Wow.
I'm sending you to my chiropractor, and I want you to go. I'm calling him right now. I want you to go straight over there and sit there until he sees you, and I will tell him what I see and what I think he should do to you, and your blood pressure is going to go down. And she went to him twice. Her blood pressure returned to normal. She made her son's wedding, and I got to drive the truck.
That is just a perfect story, right? How often do we look down one path thinking that's the only way to look? And if we just turned our head even 10 or 15 degrees to another direction, we might be able to solve a problem or at least uncover a cause. That's phenomenal. And I'm guessing you have hundreds of stories like that.
Yeah, that one's a lot of fun, but I do have
I think the truck part is what really makes it fun, right?
Yeah, everybody likes a big truck. Right?
That's great. That's great.
She was really one of my fun things, because it was really an example. And I don't mean to put down Western medicine, because there are many things about Western medicine that are wonderful.
Yeah.
But they were looking at her cardiovascular system without taking any context into account She had a car accident. That's a major event. We
Yeah.
should look at maybe that had something to do with what was going on. But
Right.
then being able to see what it was that had happened in the car accident, which
Right.
was where my piece of the thing came in.
Right. Well, and I think also, and I'm really glad you told that story, because I think our listeners can also benefit from being in a situation where there's a sudden change in somebody's health status, and to be able to say to whoever they go to see, a doctor, whoever, to say, there is one other piece of significant information where everything was fine until this point, and what about that point might be worth looking at.
Right. And she had never considered it because the doctors were all looking only at her cardiovascular system.
Right, right. I remember actually having a conversation with you about all the over the counter medications people are taking, the Prilosec, the Pepsids, the Zantac, all of that. I mean, people are eating that stuff like candy, and people feel relief from taking those. But I remember you talking about how there are other ways to address those situations, and that those medications don't really help you. They help you in the moment, but they don't really address the issue. And I say this because I want to spread the word about this, because I myself have been I was on something like that, and I have been off of it for years because of your help. And then again, I think you were pointing to how we're looking at it the wrong way, right?
Mm-hmm. Mm-hmm. You happen to have picked a drug that I particularly hate, because it was Prilosec and that whole class of drugs, the omeprazole drugs, were created as a pre-surgical drug to be used for people having digestive surgeries, to dry out the system so they could have a surgery. It is an off-label usage to put people on it for months and months and months and months. It was never intended for that purpose. But, and again, I'm not putting down doctors. There are wonderful doctors.
Right. Absolutely.
But gastroenterologists want you to be out of pain. They
Right.
want you to stop being in pain. They can get you out of pain by giving you Prilosec.
Right.
They don't think about the fact that it stops your body from producing digestive juices, which will have a long-term effect. Malabsorption, malnutrition, dietary problems, health problems, everything, because you're not able to digest your food because we've shut this stuff down.
Right.
Yeah, the pain went away,
Right.
but we've shut down the system. So that long-term versus short-term view of the world is a significant difference between a lot of Western medicine and a lot of alternative. And what I like to say is, if I'm shot, take me to Mass General. I want acute care.
Yeah.
But for long-term chronic issues, oftentimes the answer is in a slower, lower Eastern philosophy kind of medicine.
Mm-hmm. Yeah. And I brought that up not because we're trying to, reject all those medications or anything, but I do think that's one in particular that's pretty mainstream, and that a lot of people take thinking they're really helping themselves, when in fact it really may not be helping in essence the real issue. And I'm a poster child for that now. So thank you for that. But also it's a relatable example of what you are able to do with people that, call it psychic, call it whatever. That actually isn't even part of your psychic ability. It's about understanding different systems within our bodies, whether you look at it through the Western lens or the Eastern lens, understanding how these things work and seeing that there may be another way that could be a healthier set of choices for somebody that nobody is talking about.
In addition, the short-term experience of taking something like omeprazole or Prilosec or Nexium is very positive, so people don't realize that there's a longer-term problem that can occur.
Yes.
And I think that that's where the psychic piece comes in. I see people that have been I see babies on Prilosec. It makes me crazy. They have colic.
Right.
Who doesn't know a baby who's had colic? Babies get colic.
Right.
So they put them on this drug because it shuts them up. The parents feel better. The kid sounds
Right.
better.
Right.
And then, but long term, this kid is not going to be absorbing their nutritional support.
Yes.
So I also see people who have been on these drugs for years and years and years, and they have damaged their system from them.
Yep. Well, again, poster child. Post testimony of a poster child right here. That's really great. And I know we've talked about many other things that also are some common kinds of conditions that people have that get treated in a common kind of way, and they experience relief, not realizing that there may be another or better way to look at it. And that's a huge piece of what I've seen that you're bringing to a lot of the people you work with, and hopefully more people now that they're hearing you on this program. I also want to point out that you've written a book and you're working on another book, and I'd love to hear you talk about your work as an author and what that has meant to you going forward.
Yeah, I would tell people writing a book is like having a child.
Uh-oh.
You have to really want to do it. You have to really want to do it. You have to be committed to it, and it has to be something that you see as that kind of an effort. I do a lot of spiritual counseling with people that are trying to find their way in the world, either with their gifts that they have discovered they have to make it easier than it was for me, or for people that want to just do good in the world, or as we would say in the Jewish view of things, to do tikkun olam. They want to heal the earth. And so I work with a lot of people, and many of these people said, if you had some sort of book or workbook that I could use that would get me started, that would be great. And that was the genesis of Your Soul's Companion, which was the book that I wrote. And it's been a lot of fun, and a lot of people use it. And it's been used, my intention was that it would be a textbook, and it has been used to some degree in that way. To sort of get people to figure out if they have psychic gifts, if so, what they are, what their spiritual path should be to using those psychic gifts, and what that would look like, and what is their responsibility, and what are their moral obligations in doing so, and so on.
Very important. And I do want to hear about your new book, but I want to just maybe tap into something here. So yeah, I hear a lot of people say we're all intuitive. We all have intuition. Some of us listen to it more and exercise it more. What's the difference between being intuitive and being psychic?
We all have some. Some of us have more. And everybody who has strong psychic abilities is an empath. And that's sort of the starting point. And an empath means that you can feel what other people are feeling, not that you're sympathetic to what other people are feeling, but that you actually feel what other people are feeling. And when people are empaths, they usually have more stuff. And so that's usually where the journey starts. Everybody has some abilities, and everybody has flashes. And most people have clairvoyant experiences like, oh my God, I got to call grandma because she's ill. Or, I don't want to take that road driving because something's going to happen. And then they find out there was a car smash. Everybody has those abilities, but it's a muscle. You've got to work it. And some of us have, just like I always joke about this because it's true. If somebody said to me, run 5 miles or die, I would say I pick B because I'm not going to run 5 miles. I was meant to, I always joke about, I was meant to walk. I'm strong, but I'm not fast.
Yeah.
So I don't think that that's something I'm able to do.
Yeah.
And so there are things that I'm not able to do. So there are psychic abilities that some people don't have. Everybody has some. It's how much you have.
Right.
And most of the people that come to me have been disturbed by their psychic abilities. And they want to figure out what it is, what they can do with it, and how to control it.
Yeah. And in your case, your psychic abilities were screaming at you, basically.
Yeah, they didn't shut up.
Yeah. Now, what is that like for you here and now today? All these years later, you've been doing this. You've been, completely on your own for a very long time now, right?
Yeah. Since 2000. Yeah.
Okay. So 18 years. And did you ever find that on-off switch?
I found the on-off switch, but it's more like the turn it down to very low switch.
Got it. So like a volume. Yeah.
Mhm.
Or a dimmer switch, let's say, right?
That's a good idea. A dimmer switch, yeah.
Right.
And learning to control that through shielding is what I teach a lot of people that have psychic abilities, because if you don't shield, it kills you. It creates medical problems.
Yeah.
It creates psychological problems. I used to joke about psychic or psychotic, you know, and you know, there's a real, when I worked at the mental hospital, there were people there that were psychic. And I finally came to believe you can be psychic, you can be psychotic, or you can be both.
All right. Woohoo. And you have a new book coming out. What's that? What's that looking at?
That's called Raising Psychic Children, and I want to call it Small Mediums at Large, but I'm not sure I have the name.
I love it. That's wonderful.
And I think I want to avoid what happened to me. I think that that's a lot of it. And these kids that I see that are teenagers, that are going through the angsty stuff of being teenagers and at the same time trying to deal with a psychic gift, they're already weird enough, you know, just by being teenagers. And then to try to also deal with the fact that they can see things and that they're friends and the fitting in piece. So I'm working on a developmental book of how to deal with different kinds of kids with different kinds of ability, and a companion book for kids that kids would be able to use.
Wonderful. So your audience for both books could be children and their parents or their families.
That was the hope. Yeah, that's the hope.
And maybe even, you know, teachers or other people who are interacting with kids all the time, right?
Yeah.
Do you have a date that book will be coming out, or?
Oh, that's the hard question.
Oh, okay.
I'm about 80% done. So so it's how much I put the pedal to the metal at this point.
Okay.
And, but soon, you know, I would say within 19.
Okay.
Mm-hmm.
That gives us something to look forward to.
Well, thank you.
And how can people reach you or find you? I believe that you don't just work with people in person. You also do some work by phone or FaceTime, other modalities that you can work with people who are not geographically in, you know, Needham, Massachusetts. So
yes.
How do people find you?
Well, my favorite story about this is I had a woman in Australia who wanted to see me. And I said, look, I don't know if this is going to work or not. So let's just try it. If it doesn't work, you don't have to pay me. And I said, oh, your hair's falling out. And she goes, oh, it works. Because this was a phone conversation.
Wow.
So,
so it wasn't even like you were looking at her. Okay.
So I've been working with people all over the world by phone, Skype is a little strange because of the time delay. By FaceTime, I will do Zoom. I will do whatever people want. And that's fine. I worked with a woman in Marblehead last night by phone because she just didn't want to drive down. And I don't blame her. It's a long drive.
Yeah, it is. Yeah.
And it's lousy traffic.
Yeah.
So I work with people from of all ages.
Yeah.
I work with a lot of families, which makes me happy. I have people that I've worked with from before they were born till now, and their moms and their dads and their husbands and their sisters, and that's really fun for me.
Yeah.
I start to see patterns in families. And that's really kind of fun.
Well, and it can give people I would imagine families a heads up on any genetic issues or things that they can be proactive about, right?
Right. There's a lot of help to being proactive. I had a woman last night who I had seen 5 years ago and called me up and said, I'm now doing a completely different career with a lot of physical stress. And so I need a completely different kind of workup. I'm not in the mental stress I was in before, but I'm feeling the physical stress in my knees and my this and my whatever. I need you to look at all that stuff and tell me how to work with that.
Yeah.
So, yeah.
So that's nice. You do have people that you work with over time and can help them through various stages and developments in their lives, which is wonderful. And I think the other thing that I think is so vital about what you do, you know, yes, your gifts, you know, are critical to the process, but I also think there's something that you're really helping people to be empowered about their health and about their well-being, and to get people to think things through in a way so that they feel like, they're in control of what's going on, not just going to the doctor and being told what's happening. So
Yes.
it's to me, it's like having all those extra tools in your toolkit that you didn't even know you had.
Well, you've hit upon a really important point, and something that's very important to me just as a foundational issue, which is it doesn't matter how good the doctors are or the healers are or anybody else. We have to take responsibility for our health at some level. And if we don't do that, we're going to suffer. And
Yeah.
we have to trust ourselves and trust our judgment about our health and trust our judgment about what we're feeling, and not let anybody tell us, no, you're imagining that. Or
Right.
you're making that up. This happens more to women.
Right.
Sorry, but it's true.
Well, it is.
Let's give you a happy pill, and then your stomach won't hurt.
Right.
Well, usually the stomach still hurts even after you get the happy pill, because it wasn't the happy pill you needed. You need your stomach dealt with.
Right.
So taking responsibility for your own care
Right.
is so important, and it always has been important. And I'm not going to do the blame the doctor thing.
No.
That's so silly. It's not their job to tell you to take responsibility.
Right.
You have to do that. That's your
Right.
job.
Well, and I want our listeners to know that, there are Western medical doctors who refer patients to you.
Yes.
You have a partnership with Western
Yes.
medicine. This is
Yes.
not about blame the doctors or blame
No.
Western medicine at all. There's a
No.
role for everything. And you taught me that a long time ago. And I thought that was really important. And I also think that the whole dynamic of blame just gets us nowhere anyway.
Gets us nowhere. Right. Integrative is the concept.
Exactly.
And in your business, and we talked about this when we were talking about having this podcast, that people either have huge referral networks or they don't want to refer to anybody. I pride myself on how many people that I can refer to, because I can't do everything for everybody, nor can anybody else.
Right.
So I want to have a huge base that I can go to and connect with in order to help people. And that includes Western doctors, that includes alternative doctors. And the bigger the base, the better it is.
I say amen to that. And I also think the thing that you're talking about here about being, empowered, taking responsibility, you are a living example of that. You reached a point. I love the look you just had on your face when I said that. Like, what? Well, what I'm saying is, to tie this back to the whole theme of making transitions in our lives so that we can live more at peace with ourselves, make the living we need to make, have the life we want to have, live in full professional integrity, all of those things. And you had to go through your own trials and tribulations, and probably still do. Nobody's life is perfect, right? But at the same time, you've painted a really great picture here of how when we don't listen to ourselves, how it takes us down a path we don't need to be, both for ourselves and for everyone else around us. And so by doing what you've done with your career, you do become a living example of that kind of a pathway, of a way of thinking about how to create a life that is filled with meaning, purpose, satisfaction, making a difference, all of those things. So I want to thank you for being here today, for sharing all your gifts with me and with my listeners. I do hope that people will look you up and learn from what you have to offer. And I believe a good way for them to start to find you is through your website.
Yes. My website is huge because I keep throwing stuff on it.
Great.
And there are interviews, there are articles, there are videos, there are all kinds of things. And I just want to say one more thing quickly.
Sure.
It's important, and it totally ties in with what you just said. I think people feel sometimes like it's a choice, or sometimes they feel like it's a selfish choice to do what they want, or that they should do what's expected of them. But I will tell you that it's not only about happiness, it's about having your spirit and your mind and your body in alignment with what you do for a living. And that you don't feel right if you don't do that. It's more than just this little buzzy thing. It's big. It's your whole health. It's your mental health, and every kind of health. And so that's where I take my hat off to you about creating a transition series, because people suffer in jobs that they hate, and they suffer in careers that make them miserable, and they suffer, and there are ways to make that not be true.
Right. I agree wholeheartedly. And, everyone has to make their own set of choices. We're not preaching to everybody about this, but I totally agree. There is definitely, where there's a will, there's a way, so to speak. Right. And so we'll leave it at that for now. There's always more to come. Wendy, I am indebted and grateful for this time we've had together. I appreciate it so much. And I'm excited to see what's next. I'm excited to see your next book. And thank you so much again for being here today.
Thank you for having me. It's been fun.
I hope you enjoyed my interview with Wendy Marks. It was such a pleasure to speak with her and learn about her gifts and professional journey, along with the impact she has been able to make in so many people's lives. What is your key takeaway from our conversation? Is there something you'll be able to put into action this week that you'll benefit from for years to come? Share what resonated with you in the show notes at workfromtheinsideout.com. Look for episode 008. That's also where you'll find all the links and resources from today's podcast. If you enjoyed this episode with Wendy, please share it with your friends and colleagues. And don't forget to subscribe so you don't miss next week's show. Remember, subscribing is always free. Are you enjoying the podcast? I certainly hope so. I'd love to read your review on Apple Podcasts. It's easy to find our page at tammygoularloeb.com/Apple. Thanks for listening. And remember, it's never too late or too impossible to increase your sense of fulfillment and satisfaction in your work and other meaningful activities. Let me know how it's going for you. And who knows? Maybe you'll be my next interview on this podcast. Bye for now.
Thank you for listening to the Work from the Inside Out podcast. For more information, you can find us at www.workfromtheinsideout.com.